Well, thank you for coming this morning and being with us. And it is very much our pleasure to be able to welcome Kathy Devine from the Prescription Advantage Program, which is the state's pharmaceutical program. And it does work well with Medicare and other insurances, but it's very important information to get out to folks because it can make such a significant difference in our health insurance coverage.
That's right.
So thank you, Charlie, for coming to tape this, but thank you, Kathy.
Thank you.
Okay.
Thanks for having me.
Oh, so glad to.
Well, again, thank you, all of you, for being here. And as Colleen said, I'm Kathy Devine, and I'm with the Prescription Advantage Program, which is a state-sponsored pharmacy assistance plan, and it's administered through the Executive Office of Elder Affairs. So this is what I want to talk with you about today, but it's very hard to talk about Prescription Advantage without talking about Medicare. So we have to tie the two together. And when I first came in today, I was asking everybody what they currently have for prescription drug coverage. And one person shared that she has Blue Cross for her drug coverage, and somebody else has First Health. I don't know if you realize that just in our state alone, there are more than 20 different companies that you can get your Medicare prescription drug coverage through. So it tends to be a little overwhelming at times because with all of these companies, especially when Medicare's open enrollment starts in the fall, all of these companies, they'll start sending you information. And you must realize that's when you're just inundated with mail from all of these different companies, and they all have a prescription drug plan that they want to sell you. But they're all different, and that's why it's important to really make sure you have the right coverage. They all have different monthly premium amounts. They all have different co-payment amounts. They also all have different formularies, which that's just a fancy word for the list of drugs that they cover. But there is one thing that they all do have in common, and can anybody take a guess at what that is? If I said the donut hole, would that ring a bell?
Oh,
yeah?
Yes.
Okay, you've all heard about the donut hole. The donut hole, I like to think of it, it's like a bad nickname.
Yeah.
It's a gap that's in that Medicare coverage. And when Medicare Part D, when it first came out, and this is going back to 2006, somebody referred to that gap as the donut hole. And here we are, we're in 2014, and we're still calling it a donut hole. So it is something that it hasn't gone away. We still have it. But what I find, though, is most people, they've heard of the donut hole. They're familiar. They know that there is this gap in coverage. But people don't necessarily understand, well, how do you get to that gap? And the way you reach that coverage gap is when the total cost of your prescription drugs reaches $2,850. And it's important that that's the total retail cost. So it's a combination of what your insurance is paying and also what you're paying in your copayment. So starting in January every year, starting with the first prescription that you get filled, Medicare is adding up what that total cost is. So just as an example, let's say you had a prescription that was $50, maybe it's a generic drug, your copayment is $10. Well, Medicare is adding up both the $10 that you're paying and the $40 that your insurance is paying. And then that's going to happen with every prescription. And then at the point, if your total prescription drug costs reach that $2,850, that's when you have now reached the coverage gap. So what happens when you reach the gap? This is when you're going to pay more. And you're not going to pay those co-payments that you've been, paying since January. Your costs will go up. And so for any generic drugs that you take, when you reach that coverage gap, you would now be responsible for 72% of the cost of the drug. Now, if that's a $10 antibiotic, you might say, well, not a big deal. You know, they'll cost me $7.20. But I think you probably all realize that, you know, just because we say generic doesn't always mean inexpensive. What if it was a $100 generic drug? You would then have to spend $72 for that. And then brand name medications would be responsible for 47.5% of the cost of the drug. And a lot of your brand name drugs, particularly things like inhalers, can be very expensive because the retail cost of an inhaler sometimes averages around $300. So you can imagine we now had to pay 47.5% for that. So this is a long way of leading up to what is Prescription Advantage and how can Prescription Advantage help. Prescription Advantage is going to supplement your Medicare Part D. It doesn't replace it. So you have your Medicare plan, and then you also have Prescription Advantage. And your Medicare plan is going to pay first. And then at the point when you've reached that coverage gap, that's when now Prescription Advantage is going to help. So just to give you an example, let's say somebody did have that $300 inhaler, and now they reach the coverage gap, and they're at the pharmacy, and maybe it's something that, you know, prior to reaching the gap, maybe the copayment you were used to paying was maybe $30. But now you've reached that coverage gap, and you're not going to hear, that'll be $30, please. You're going to hear something more like, that'll be $142. But if you have Prescription Advantage, before you open up your wallet and take out that $142, you want to make sure your pharmacy knows that you are a Prescription Advantage member. You have an ID card, and the pharmacy will then bill that $142 to Prescription Advantage. And depending on what membership category you're in, you would hear that'll be $30, or it could even be that'll be $18. So Prescription Advantage is going to be able to help lower those co-payments. Now, as a state-sponsored program, that one of the nice things about Prescription Advantage is that you can apply for it at any time. You know, Medicare has an annual open enrollment. They have that little window of time at the end of the year that you can, you know, compare your plans, you can change your Part D plan. But if you miss that open enrollment, you know, you would have to go the following year with the same insurance, which may not be the best plan for you. But with Prescription Advantage, you can join at any time. We don't have that little narrow window of time. And as far as qualifying for Prescription Advantage, because it is a state-sponsored program, we do require that you are a Massachusetts resident and that you meet our income guidelines. Now, to have coverage in that coverage gap, for a single person, your gross annual income cannot exceed $35,000. It's actually $35,010. And for a married couple, it's $47,190. So that would provide you, if your income is at that level or below, you will have coverage in the donut hole. And we use gross annual income. We don't look at assets, because oftentimes people will say to me, oh, I would never qualify for Prescription Advantage because I own my home. Well, that doesn't matter. It doesn't matter that you own your home. Okay, all we care about is what is your gross annual income. and that home that you own is in Massachusetts. So that's, that is important. Now, how do you apply? I think one of the best ways to do it is to call your Council on Aging, okay, where they have copies of our application form, or you could always talk with a Shine counselor, and I know you have great Shine counselors in this area, and you could sit down and talk with the Shine counselor, and the Shine counselor can not only help you with Prescription Advantage, but he or she can also just kind of look at the big picture and say, gee, there are other benefits that are available, in whether they're federal or state benefits that you may qualify for. So oftentimes you might go visit a Shine counselor for one reason, but then come out of there realizing, my gosh, I just saved $300, by making some changes to, maybe it's your Medicare Part D plan, or just finding out that you're eligible for another benefit that you didn't even know that it existed. So Shine is always a great resource. And Prescription Advantage, if you were to call Prescription Advantage for an application, they would even offer to do it over the phone with you. So our application form is a very simple form, but if you could do it over the phone, you can do it that way. So I'm going to give you the phone number, and actually this is a phone number for both Prescription Advantage and for Shine. And it's a toll-free 1-800-843, this is where I now have to look and to make sure I'm not giving you the wrong number. Okay, 1-800-243-4636. Okay, and I'll repeat that. Okay. To reach either Prescription Advantage or Shine, you would call 1-800-243-4636. And then you will get one of those automated prompts. And if you want to be directed to Prescription Advantage, you just press 2. If you want to be directed to Shine, you press 3. And then after you do that, you will get a real person. So it's a very, simple prompt. And I think that's probably everything I can tell you today about Prescription Advantage. So does anybody have any questions? Yes.
So this is strictly for that gap that would happen. This is strictly for that.
That's when the benefits help the most, is when you do reach the coverage gap.
So like I have Blue Cross and Blue Shield Hospital and Doctor, and I also have the medics in the Blue Cross and Blue Shield.
Yes.
But that would still help me?
Right. The question is, one of our participants here has both has Medicare and also a Blue Cross medics plan. Okay. That medics insurance that you have is actually going to help to supplement your Medicare Part A and your Medicare Part B. It's not covering your prescription drugs unless you have Medics Gold. But is it Medics Gold? Then that would cover your prescription drugs. Okay. The medics plans they have a few different products that they offer, so you really need to look to see just which one do you have, because it's only the Medics Gold that actually covers prescription drugs, the others don't. But the others help to supplement your Medicare Part A and your Medicare Part B. So your Medicare Part D is then again separate, because your Medicare Part D is what's covering just your prescription drugs. Well, maybe that's all the more reason to talk to a Shine counselor if you're a little uncertain, because what happens is you get all these ID cards. For everything that you have, everybody has their ID card, and you end up with a wallet full of them, and then you just have to scratch your head and say, which one's for which? So, but that's something, to talk with a Shine counselor who can help sort that out for you. And the Shine counselor can also make sure that you're not overspending. You know, you don't want to have so many cards in your wallet that, you know, you're paying too much for your insurance. And that is actually something I didn't mention with Prescription Advantage. There is no monthly premium. So if you're a single person and your income, as I mentioned, is that $35,000, $10 or less, or as a married couple, if your income is $47,000, $190 or less, Prescription Advantage is free. So why wouldn't you want to sign up for it? Particularly, you know, if you ever did reach that coverage gap. This is something that, yes, you'll have another card in your wallet, but it's probably the most valuable card that you could have, because this is the one that's going to help pay for your prescriptions when you do reach that gap.
Because on that's where they really need the Shine Council to say, but that doesn't kick in until you have to have another plan.
Exactly.
But, you know, the other, I'm just thinking, I mean, that the other interesting piece is that if somebody does not have a supplemental insurance plan and does not have Prescription Advantage, as they apply for Prescription Advantage, they have an opportunity then to enroll.
That is a great point, and I'm glad you brought that up. It's one of our additional benefits of being a Prescription Advantage member. I mentioned Medicare has their open enrollment every year. And it's the same time every year. It's October 15th through December 7th. And we strongly encourage everybody to take advantage of that open enrollment period to make sure that for the following year, you have the best prescription drug plan for you. You know, maybe in 2013, maybe you had, we'll say Blue Cross, just as an example, and it worked great. You know, it covered your medications, the co-payments were reasonable, the monthly premium was fine, and everything worked. And then open enrollment comes and you say, you know what, I'm happy with what I have. I don't need to do anything. And then the new year starts, and that's where you might find out that your plan made a lot of changes that you weren't aware of. And, you know, maybe the premium went up, maybe the co-payments went up, maybe something that was, your co-payment was on a tier 3, now became a tier 4 and went higher. You know, and a lot of people are caught by surprise when they go to the pharmacy. And ordinarily, if you didn't make that change, you'd be stuck with that plan for the whole following year. But the additional advantage of being a Prescription Advantage member is that as a member of Prescription Advantage, you have one additional time a year that you can change your Part D plan. And this is outside of Medicare's open enrollment. So let's say it's January, you go to get that prescription filled, and that's when you find out your plan isn't covering this anymore. And you say, you covered it last year. Why isn't it covered this year? Well, they made some changes to their formulary. But as a Prescription Advantage member, you could now say, well, you know what, I'm going to see if there isn't something else that might work better for me. And you can change your plan. And that's something that a Shine counselor can help you with.
That just happened to me last week.
Did it really? It just
I
happened
took
to
my
you?
prescription in because it was always covered for 6 months,
Yeah.
3 months.
So those are some
And I
of the
had no
things.
idea.
Right.
It just happened.
It's important to understand your Part D plan, and you know, because sometimes there are different restrictions, maybe different restrictions on drugs. So, you know, you want to make sure that you understand what it will cover.
It's okay. It's all right.
Keep on going.
Did somebody else have a question?
Another way, I mean, we stayed with the same plan because we did talk to Shine again. We've been on it for a while.
Right.
But if you're looking at another plan, call that company and ask for their new formulary for the next year. And
That's
compare what your drug is and what their cost
Yep.
would be compared to yours.
Yeah, that's always a good thing to do, is to make sure, you know, if you're making,
I'm so glad I came here to listen.
if you're making
I pay
change.
$100 a month for that.
Yeah.
And
that's-
now, I was flabbergasted when that
And-
medicine's done.
Yeah, and Prescription Advantage is something that could possibly help you with that. So, once we're
and the other
finished
thing
here,
is,
we'll
if-
talk a little bit more.
We had Blue Cross Blue Shield Gold when we initially retired.
Mm-hmm.
And now we're thinking, oh, it's our tax guy that said, why are you paying all this money?
That's right.
So anyway, we looked into the different plans. But if you have to get out of the gold and it's always been good for you, you can't get back in.
That's true.
It's
That's
over.
true. That
That's
Medic's
over.
gold.
So it depends how good
Yeah.
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 Absolutely what you're doing.
If you were to give that up, there is no going
There's
back.
no going back.
So, but you know, there are so many other
Yeah,
ways
yeah,
that you can,
that's right.
you know, that you can look at your insurance. And again, I know I've mentioned Shine
How do you?
about 100 times, do you think?
Yeah.
But it's so true. This is what they'll be able to do, is sit down and say, okay, this is what you currently have and this is what it's costing you.
Right.
And now here is another way of, you know, achieving the same goal, which is to make sure that you have complete coverage, that your prescriptions are covered, and you may find that just by making a few changes, you could end up saving an awful lot of money every month. So they are the experts, and the nice thing about a Shine counselor is that it's one-on-one, that you can sit down, talk to the Shine counselor. He or she will go over everything. They will help you select what Medicare Part D plan. And as you said, you didn't make a change because what worked for you last year ended up being the best one for you this year too. And that's great. So at least you know from having gone through the experience of making the comparison, because oftentimes people make that comparison or actually don't make the comparison, and as I mentioned earlier, they find out the hard way
Or a
that they should have.
pharmaceutical company may have had the drug last year,
Yep.
and now they're not covering it except with permission from the Pope is what I call it.
And, you know, the
they're
other
just-
thing that in selecting plans too, and it's a new trend, it seems to be a new trend that started over the last year or two, is that a lot of the Medicare prescription drug plans have what they call preferred
Yes.
pharmacies. And it's just a way of, if you use their preferred pharmacy, you'll pay a lower copayment. So when you're looking at your, trying to decide on plans, you want to make sure that, if you go with a particular plan, you'd want to make sure that you're using their preferred pharmacy so that you can get the lower copayment. And sometimes that's just a matter of walking across the street. And I say, I've always gone to Rite Aid, but CVS is this plan's preferred pharmacy, and they're right over there. So if you can save some money just by going to a different pharmacy, and that's something again that Shine would go over all of that with you to make sure that you're getting the most value from your coverage. And I know, Shine, we'll talk with you about Prescription Advantage, too. They won't let you leave until you've heard about Prescription Advantage and how that can help lower your costs. Any other
Do
questions?
these Part D plans, what happened to me was they had sent me the so-called formulary for 2014.
Yeah.
And then, so I stayed with the same plan, but when we got into 2014, I began getting these notices that, they're not going to cover it as much, or it's going to a higher tier, or they're not going to cover it at all.
That's some of the restrictions that oftentimes people are not aware of. Yes, my drug is covered, but there's a requirement for that particular drug that there's step therapy involved, or there's prior authorization that's involved.
Yeah, but even needs
So-
the prior authorization to do
Yeah.
that, because I tried that.
And, or it's just a matter of, yeah, they're still covering my drug, but they have changed it from a tier 3 to a tier 4.
But they can just change it at random then.
They do.
They're not tied to a time.
No, they can make changes. They should be notifying you of changes that they're
But
making.
is that because they themselves have changed the company that they are dealing with for their drugs?
It's possible. It's
So
possible.
It's either gonna cost them more or it's gonna cost them less.
Yeah. You
Like
know,
if they're saying your generics are only gonna be $1. Well, that's not always true. Omeprazole is a generic of Prilosec and there's not much difference in the payment. So you really have to, I find pretty tricky.
Yeah, I do too. You
Yeah.
gotta watch.
Yeah,
It's
you really do.
it's you really have to pay close attention and
And when I called Medicare
yeah.
to find out about that, they said, well, yes, it's a generic, but it's an expensive generic. Well, it doesn't say in the book, I'm expensive, or I'm, you know what I mean?
You're right. And so there could be, multiple tiers for co-payments, and your least expensive generic, your middle price generic.
And you're expensive generic.
Right.
And you don't find out till you go to pick it up.
Yeah.
Sometimes.
When a Shine counselor,
I called them.
Yeah.
when a Shine counselor is helping people select their plan, there's a tool that they're using. And it's actually part of Medicare's, it's right on Medicare's website. And it's medicare.gov, G-O-V. And then you click on, and I think it says find a drug plan. And this is the tool that a Shine counselor would use, or for anybody who is comfortable, using the computer, you could do it yourself. And you go to this website, and you input very basic information, your zip code, your Medicare number, and what pharmacy you use, and then you enter in all of your prescription drug information, the name of the drug, the quantity, and the dose. Okay, so that's all on the label. And then when you enter it, what will come up are all of the plans that would work best for you. And the nice thing is, it will tell you exactly what your costs are going to be, so that you will know how much you're going to spend for those prescriptions based on the plan's co-payments. And it will also tell you exactly what time of year you will reach the coverage gap. So there's a lot of information that you can get up front to help you be prepared. And that's when, of course, during Medicare's open enrollment, or if you're a Prescription Advantage member outside of Medicare's open enrollment, it's an opportunity to be able to look at what other plans are out there and do I really have the best plan this year? This is something that might work better for me. So you can find that out. Yeah. I have a feeling Shine's going to be very busy. They're going to blame me for this. But that's okay. This is what they do, and they want to help you. They want to make sure that you're not overspending, that you have the coverage that's working best for you. They want to make sure that you're going to have coverage in the donut hole if you happen to reach that gap.
Right. And now just an example of Prescription Advantage joining late in the year.
Yeah.
Okay.
You can join
well,
at any time.
That's what I did this past year.
Yeah.
And within a week of having had it, I hadn't even received my permanent card yet. I just had a number. I had to change my drug. And it would have cost me out of pocket if I hadn't done that over $600. And it cost me $260.
Oh,
I mean, it's still a lot of money when you look at it, but
sure.
It's the difference is a big savings.
absolutely, it's a big
Exactly.
difference.
Yeah.
And then on another prescription that I had picked up at Caremark, usually I send away for them if I have time, but they'll give you a 30-day supply, which is going to cost you probably a little bit more than the 90-day supply. But there was a little thing up on my the receipt that said others, almost $13. And I said, what is that? Because I called him. I hadn't noticed it until I got home. And I said, what is that amount up there? He says, that's something that some other insurance company gave you. And I said, is that Prescription Advantage? And he says, no. I said, what is it? He says, we don't know what it is. But it kicked in another $13.
Well, let's
I mean-
hope it was Prescription Advantage.
Yeah.
If it saved you money, it must have been Prescription
It must
Advantage.
be, no, they said it wasn't.
Yeah, isn't that interesting?
Yeah, he said there are some companies out there that will pick up, and it must be for people that hit the hole. I can't imagine it being otherwise, or just,
I
I don't know.
That's a new one on me, but
They wouldn't say it.
at least it didn't go the other way that they were charging you an
Right,
additional
right. No, well, that's what I
$13.
wondered, because
Right.
no, I knew the cost of the
Yeah.
drug, so it's just, but I couldn't believe it. So,
Well,
Thank you very
thank you,
much.
everybody, and thank you for, your questions and your examples, and, it's great to hear how Prescription Advantage is helping people, and thank you very much, and thank you.
Thank you for coming out. I really appreciate it.
Oh,
And
right.
I'm sure, I'll have information in the office that we can share and
Great.
phone numbers that
Yeah.
we can share too.
Excellent.
Thank you.
Thank you. Okay, thanks so much. All right.
Thank you very much.
Oh, thank you.